Chelsea Rikis here with a compliance update. As you know, compliance is complex. My goal today to limit the insurance jargon and really help make sense of what's going on with the No Surprises Billing Act and specifically how it interacts with the ACA max out of pocket. So last week, there was new guidance released. Today, we're going to dive in. What does it mean? Why does it matter? So what you need to know is both the No Surprises Act, which was wrapped into the Consolidated Appropriations Act of 2021, and the Affordable Care Act put measures in place to protect and regulate participant cost sharing. This is important. Medical bankruptcy is no joke. It's a very real thing in our country. Measures like this help to protect consumers. So let's start first with the ACA. All ACA non-grandfathered health plans must impose annual maximum limits on participant spend, specifically for in-network essential health benefits. An out-of-pocket max is a cap on the amount of money that you have to pay in a covered year for covered services under your healthcare plan. So if you meet that limit, your health plan then pays 100% of the covered healthcare services for the remainder of the year. So for example, maybe you have a $5,000 out-of-pocket max. Once you've hit that, your health plan pays for all covered services for the rest of the year. The No Surprises Act, on the other hand, addresses out-of-network costs. And we see out-of-network billing issues most often in two big ways. Number one, a participant uses emergency care or air ambulance services from an out-of-network provider. Not their fault, it's an emergency, right? Number two, a participant receives care from an out-of-network provider by accident at an in-network facility. Well, the No Surprises Act says that in both of those instances, the participant can only be billed at the in-network rate for those services. So like many of us, I've had personal experience with this. In 2019, I needed an outpatient procedure. I made sure, because I do benefits, that the facility was in-network, and I requested an in-network physician. Well, I got the bill a few weeks later. The anesthesiologist was out of network. I was billed as such, close to $4,000. Had the No Surprises Act been in place, I would have instead been billed the in-network amount, which would have been a much lower bill for me. So how do they interact? Well, the FAQs that the Department of Labor, Health and Services, all the big departments released last week, it states that the plans cannot evade both of these protections at the expense of the participant. So here's an example. If a service or provider is considered out of network under the surprise billing protections, the amount the participant pays for their care will not contribute to the ACA maximum out-of-pocket limit. But the care will be subject to the surprise billing protections, therefore meaning they can only be billed at that in-network cost. On the flip side, if a participant receives in-network care, that care will not be subject to surprise billing protections because that has to do with out-of-network, right? But the billed amount will count towards the individual's out-of-pocket limit, which is great. So I hope that helps to clarify how the No Surprises Act and the ACA out-of-pocket max limitations work together. Stay tuned for more compliance updates on our next Ethos edition.